I don't think that patients will perceive any difference, primarily because they'll be using GP information, and the GP information which is already there, that information will be used to benefit healthcare provision across all patients in Scotland. Well, I think there's clearly different aspects of the Spire and the way that GPs can use information. I mean, one of the principal aspects is for those patients who have particular health issues. I'm thinking in terms of people with asthma, people with heart problems, diabetics, where the GPs will be able to identify the patients that suffer these conditions within their practice and be able to target these patients and provide them with particular treatments and know exactly when these treatments are required. I think patients' concerns are certainly something that Spire has paid great attention to. We're very, very confident, I'm sure that the Spire people are, that the information that they collect and the way it's safeguarded will ensure that they'll get the best possible outcome. Well, I would say that GP practices in the main have certainly bought into this particular proposal. The benefits from GP's perspective are quite obvious, and I'm sure that GPs will make use of the information, particularly in relation to different things that can occur during the course of the year. If you have a flu outbreak, for example, they'll be able to take particular action. They'll also be able to develop knowledge on a whole range of issues, particular to different treatments. Particularly in relation to research, there's a whole number of aspects that can be taken forward, and Scotland will be in an advantageous position in using primary care information, GP-based information on actual cases, real cases, to effectively improve healthcare across Scotland. GPs will have information at different levels. They'll be first and foremost having the information at the practice level. And you can also get the picture across the whole of Scotland to see exactly how different areas are impacted by different problems in relation to health issues, be it those that, for example, maybe suffer from something like multiple sclerosis or whatever. How best to ensure that these patients are getting the best treatment and that the GP information is used to the best advantage. Well, I think the big emphasis now in terms of Spire is that this is really primary care information which is going to be developed in a particular way with the way that the information is collected and disseminated back to the GP practices by NHS Scotland to ensure that they have the tools to ensure that they can effectively identify and monitor what's best for the patients in their own practice. It's much more personalised.